Hey, Dada.
Hey, what's up, Papa?
What's appendicitis?
Ooh, appendicitis is inflammation of a vermiform appendix. It's a little attachment that comes from the cecum that normally, sometimes in people that their diet's a certain way or just for anatomical reasons, you get a little bit of poop that gets stuck in there. And as that poop grows E. coli or the bacteria, it gets inflamed. And so appendicitis is inflammation of the vermiform appendix. Keep in mind that the vermiform appendix is found in the lower right quadrant. And normally there's going to be rebound tenderness. When you press down and you let go, the patient has extreme pain. And notice that the space between the umbilicus and the iliac crest, where you press down, where you have rebound tenderness, that's called McBurney's point. So students must be familiar with that as well. People that have appendicitis, every time that you have peristalsis, their intestines move, it's going to trigger pain. So the patient will be NPO as soon as that they're deemed to be having appendicitis. You should have no warm compress because that might cause the appendix to rupture. You have to look out for the elimination of pain. If the patient's appendix ruptures, then that means that it ruptured and the pain usually goes away. So you have to be careful when giving medications like morphine until the doctor has definitely determined that, hey, it hasn't ruptured yet and things like that. Keep in mind that there's something called the psoas sign. The psoas sign is when you put the patient in bed and you extend the right leg backwards. And if the patient has pain, because we have something called the psoas muscle there, or discomfort, then that's an indication of potential appendicitis. You can also lay the patient flat, lift up their leg and turn to the side, and the obturator muscle, as it twists, it pulls down on the lower right quadrant, and that might also exacerbate pain. So all of those are indications of potential pain. When people have appendicitis, we have to have it removed sometimes. You can do an open appendectomy, or you can do a laparoscopic appendectomy. Laparoscopic is when they do little incisions, they inflate the abdominal cavity with carbon dioxide, and then they can facilitate the removal, and it's a less invasive procedure. Keep in mind that after an appendectomy, the patient might have some right shoulder discomfort because the gases irritate the nerves that innervate with the shoulder. So you want to encourage ambulation to help that gas alleviate from the body, and hopefully that will take care of the pain. But in a nutshell, Papa, that's appendicitis.
Thanks, Dada.